Hello, everyone. Hello. All right. My name is Jaymie Baxley. I'm a reporter for North Carolina Health News. We are an independent, nonprofit news organization that covers issues and policies that affect the health of North Carolinians. At NC Health News, I report on health challenges faced by people in rural communities and the state's Medicaid program, which covers many people in rural communities. Gotcha. Earlier in my career, I worked at newspapers in rural parts of the state that were hit especially hard by the opioid crisis. So during this panel, we'll be talking about the epidemic's toll on rural communities and things we can do to give audiences a deeper understanding of the problems and its solutions. I'm joined this afternoon by Jessica Schwind, Director of the Institute for Health Logistics and Analytics at Georgia Southern University, and Irene Walker, an Overdose Response Strategy Technical Advisor for the CDC Foundation. Thank you both for joining us. Before we jump in, I'd like to ask Jessica and Irene to tell us about themselves and the work they do. Jessica, let's start with you.
Sure. Can you hear? It's on? Okay, cool. Hi, guys. My name is Jessica Schwind. As mentioned, I am an epidemiologist and Institute Director at the Institute for Health Logistics and Analytics. We call it IHLA for short because it's a really long name, at Georgia Southern University. We're primarily a service-oriented institute that really focuses on improving and transforming the health and well-being of communities through evidence-based practices and technology integration. We really were born out of the pandemic. We started the Institute in January of 2022 when we saw that many rural communities across Georgia really needed assistance in weathering the effects of the pandemic, and we helped the state of Georgia with some statewide COVID-19 mitigation implementation. So really happy to be here today. Rural communities, as you could probably hear from my voice, is where I come from. I'm from central South Georgia, was raised on a farm there, and now I'm currently raising my 14-year-old twins there as well. My father's a farmer, so it's very personal to me, but professionally very exciting as well.
Great, thank you for that. Irene, would you mind telling us a bit about yourself and your work at the CDC Foundation?
Yes. Can everyone hear me? Okay. Hi, everyone. My name is Irene Walker. I am a technical advisor for the Overdose Response Strategy at the CDC Foundation. And so the Overdose Response Strategy is a unique public health and public safety collaboration whose mission is to reduce drug overdose deaths and also save lives across the United States. And so we have ORS teams. Our ORS teams consist of a public health analyst and a drug intelligence officer. And so public health analysts, they really leverage their expertise in public health. They help to foster connections between public health and public safety. And our drug intelligence officers, they really leverage their connections with public safety. They also focus on bringing their drug intelligence knowledge and fostering connections between public safety and public health. And so together, the ORS team works on overdose prevention activities within their community. They also collaborate with public health and public safety on various overdose efforts. In general, we have 61 ORS teams across all 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. And so in my role, I provide technical assistance and support to 8 teams in the south and southwest portion of the United States.
Great, thank you for that. So the opioid epidemic's impact on rural communities, it's often framed as an established fact, right, rather than an evolving story. We tend to treat the crisis as a foregone conclusion in rural America. It's something we think we already understand. In your experience, what are some of the most misunderstood aspects of opioid use trends among rural populations?
So when looking at the most recent data from CDC, for the first time in a little over 5 years, drug overdose deaths are actually down, declining by a little bit over 25% in the past year when looking at the data from 2023 to 2024. However, with more than 80,000 deaths that number is still more than double than what it was a decade ago, really showing that the crisis is far from over. And so when looking at rural populations, it's a misconception to think that overdose trends are uniform. Overdose trends vary from county to county. They can look different in different areas. Certain areas may have higher rates of overdoses. In addition, the drugs prevalent may look different by geographic region. Our ORS teams are working on these gaps by working on projects such as expanding naloxone distribution. They're enhancing data sharing between public health and public safety and really helping their local partners with rapid response planning so that they can respond to emerging drug threats in their community.
Great, thank you. Jessica, would you like to add anything?
Yeah, so I want to tell you a little bit about a project that that IHLA is involved in through the Georgia State Abatement Trust that was put together from opioid settlement dollars. We were awarded money in order to help rural confinement facilities increase their harm reduction initiatives. So we call it ROAR, so Rural Opioid Harm Reduction for Justice-Involved Individuals. Really what we're doing with this project is trying to increase the number of confinement facilities that are offering harm reduction activities, whether it's increasing their access to naloxone, whether it's increasing tools that help recently released inmates to thrive as they re-enter the community. We're really focused on trying to elevate the confinement facilities and their offerings, because we know that people who are going through re-entry are at some of the highest risks for opioid overdose. Sometimes I've seen studies ranging from like 8 times the risk all the way up to 129 times the risk that first 2 weeks upon reentry. So, you know, when we talk about misconceptions, I think there are a lot. I am learning a lot through this project. You know, we had a really great data talk earlier this morning where we saw some of the numbers, but just on the ground, anecdotally, I'll say, you know, when the opioid crisis really started to come to light, there were a lot of discussion around like peel mills, right? But this is not a prescription opioid problem. While that is certainly prevalent and while it's still there and still an issue, what we're seeing is a lot of changes in the types of drugs and in particular illicit fentanyl. In drugs that you would not anticipate fentanyl to be in. And so what you see is a movement of different types of drugs from metropolitan areas to rural areas and vice versa. It's a two-way street. And so when you think about misconceptions, I think understanding the environment is going to be one very important thing that helps to kind of combat those misconceptions. Another misconception that I think is important to consider, simply because this is the world I'm involved in, is really looking at the justice system, the criminal justice system, as not only you know, there for punishment, right, but rather as an intervention point. When you look at the data, as we did this morning, the number of people with substance use disorder that's involved with our criminal justice system is very high, sometimes up to 2/3 has been estimated. And so looking at the justice system as an opportunity for intervention and not just as, you know, the gavel is coming down, you know, is really important and sometimes a source of misconception.
So this is kind of an extension of my previous question, but when rural opioid use is covered in the media, what stereotypes or oversimplifications do you see repeated that you think reporters should avoid?
So rural communities are diverse, and so what's happening in one county may be completely different from what's happening in another county. So really taking a look at what's happening in that particular community that you are covering. I think in addition to that, sometimes coverage can tend to focus on reporting the numbers. So not only focusing on reporting the numbers, but focusing on reporting the local solutions. Also including voices from people with lived experience is very beneficial.
Yeah, and to add to that, which I completely agree with everything, when you look at those differences between county level data and census tract data, that's where that story starts to unfold. I will say that one thing that we do at IHLA is that we focus on storytelling and how it intersects with that data, because to me that's what makes the data more powerful. And we're not saying rural solutions or one size fits all, as you mentioned, because what could be really beneficial in one rural area could just fall flat in another rural area based on the work that's being done. And so at IHLA, we do take that strengths-based approach that was also talked about this morning. And instead of focusing on, well, you don't have a hospital, you don't have clinics, you don't have transportation, you don't have all of these things, we say, well, what is working well in the county so that we can then try to get more resources to amplify their impact. And I think that's really important because, you know, when you think about the data and when you think about the misconceptions and what sometimes paints a different picture, yes, you may have one demographic in this county that follows the trend, the nationwide trend, but next door or in a different tract, it will be completely different. And I'll tell you, because we're in the forming stage of this program, we're doing a lot of listening and asking a lot of questions. And the thing that keeps coming back to me is it is not one demographic, it is not one gender, it is a issue that spans socioeconomic, strata. It affects all people. It affects all families. And so I think sometimes I know there's a lot of stigma involved in trying to put people in a box. And to me, that would be the first wrong step.
Sure.
Yeah.
Sure. Well, speaking of data, what are some underreported or emerging trends that journalists should be maybe paying closer attention to right now?
So I think not only looking at the data from CDC, the most recent data, but also looking at the landscape of the evolving illicit drug supply. And so it's really further complicating overdose prevention efforts and overdose response efforts. And so in general, when looking at the data, fentanyl is the primary driver for overdose fatalities. But there have been changes in its strength, its potency. In addition to that, there's been an emergence of novel substances such as xylazine and medetomidine, which add an additional complexity to the opioid epidemic.
Mm-hmm. Yeah, and I feel, I'm trying to think of where to start with this question because everything that's happening in Georgia. So in Georgia, the Department of Public Health does an amazing job in gathering opioid-related data. DBHDD here in Georgia does a great job in the health services, the healthcare services. As an epidemiologist, I would love more data, and I would love trend data that looks at the counties who have amazing drug courts and how those drug courts impact the success of reentry and reducing recidivism. So again, because our group looks at, works with the criminal justice system, I think there are so many excellent points of intervention, and I would love to see data county by county on successful reentry and recidivism reduction across the continuum of care, meaning, yes, people who are in active crisis, intervening, of course, looks one way, but people who are in active recovery looks another way. So I would love more data around those points.
That sounds like a nudge. Is that a nudge for the people?
Well, I mean, you asked,
Well,
so.
that would be a great story, though.
Yeah.
So many rural residents with opioid use disorder rely on Medicaid for treatment and recovery services. How could recent or potential changes to Medicaid cuts, work requirements, shifts in coverage affect rural communities' ability to respond to the crisis?
So cuts to Medicaid can definitely hit rural communities extremely hard. Many of these communities rely on Medicaid to get treatment for substance use. And so reductions in funding can cause clinics to have to cut back their services or even close, which can cause longer wait times as well as just a reduced support for people with substance use. And so at the federal level, changes can affect local prevention programs that depend on grants, really making it hard for us to reach people early and keep them healthy.
Yeah, and just to build on that, we know that rural areas already have fewer providers, and the impact of the social determinants of health on, outcomes, especially as it relates to opioid use disorder, is so profound, whether it's transportation, whether it's housing, whether it's social connection and support. I really think that it's important that we acknowledge the strengths in the rural areas, that we continue to think about how we can amplify those services. And another thing that I have written down here, because I was thinking about it earlier, was, we made a lot of strides in telemedicine during COVID-19. One thing that was not mentioned, or maybe I missed it, was the strides that we also made with medications for opioid use disorder. What we're seeing is rural areas were really quick to pick up MOUDs, but the rates are dropping fast again. And I don't know what the drivers of those rate drops are, but I think I have a couple of ideas. But I think really understanding the complex interaction between rurality and MOUD use, right, is going to be very important. Again, tying it back to the criminal justice system, when you're in rural areas, right, and you're looking at confinement facilities such as county jails, the ability for people with opioid use disorder to get medications for addressing the opioid use disorder, it is very low. And it's for a variety of reasons. Jail staff, they're facing workforce shortages. A lot of rural county jails also have contract workers bringing in to have basic health care needs met, but anything going beyond that is going to be more difficult. So when you look at MOUD uptake in rural county jails, I feel like there's a lot of opportunity for us to really make an impact in terms of evidence-based practices in those areas.
So beyond naloxone distribution and medication-assisted treatment, what innovative or overlooked harm reduction strategies are showing promise in rural areas?
So at the ORS, I've seen ORS teams work to minimize these gaps by working on things such as post-overdose outreach programs, on rapid response planning at the local level with their partners. Just to give you an example, in Clinton County, New York, the ORS team helped Clinton County and partners to facilitate an overdose fatality review. And so they brought together partners from law enforcement, healthcare, and community partners all together to review individual overdose death cases in detail. And so the goal was to really understand the circumstances surrounding the loss, as well as identify system gaps and also opportunities where an intervention may have made a difference. And so the ORS team was able to really help Clinton County develop a community-driven approach when it comes to the overdose fatality review process.
Well, so I can only speak to Georgia, but I think it is really important, especially from like a reporter's perspective, to think about the audience, to think about what may be true here could be completely not true here, right? So like because public health changes so drastically from state to state, even things like naloxone access or medications for opioid use disorder, the bar, right? It needs to be brought up to a certain level across all of the states, right? And so some states are more advanced than others. So when you're talking about innovation, New York is going to be categorically different from Georgia. Like, for example, syringe exchange services were being talked about and implemented, and data was being released when I went to school in New York State in the mid-2000s, like 2005 or so. But even today in 2025, people's level of comfort, knowledge, destigmatization around syringe exchange programs is different here. I mean, you know, and I think that's really important because different rural communities would be more apt to accept other programs than others. And so I think that's really important. When I look at some of the innovative things that are happening in rural counties in Georgia, one thing I want to say is rural people are very handy, and they are very, when somebody makes up their mind to do something, they're not going to wait, right? And so I have one county that I'm working with who their EMS providers were like, we are seeing overdoses right and left, and every time we go to people's homes, they do not have naloxone. So they have developed a leave behind kit. And other states would be like, yeah, we're already doing that, right? But again, it's not uniform. But so this one county is now, every time they go out to a call, they're just leaving behind some naloxone, some educational materials, and some other supplies that may be helpful. And that was a homegrown idea. There are other things like mobile harm reduction units that have shown some promise. Of course, the mobile aspects of things in rural areas. I mean, y'all know how awesome bookmobiles are, right? So that is another innovative approach where data is coming in and showing that yes, there is a startup cost, but in terms of effectiveness, the data's there, you know, whether it's access to clean needles, whether it's passing out naloxone, or educational materials. So I think there's a lot of innovation out there. I think rural communities can learn a lot from each other. But what is successful in that community is only going to be realized when community members are involved in the program implementation.
So we're talking about, I don't know how many people we have here who are actually part of like a rural newsroom, right? But many rural reporters work in small newsrooms. They have limited time and resources. If they can only dig deeply into one facet of the opioid crisis this year, what would you recommend they focus on?
That's a tough one. I would say focusing on stigma and local solutions. And so stigma can be a gap as to why people are not getting the help that they need. I think going beyond the access to treatment and focusing on those barriers, whether it be judgment or shame or even fear of legal consequences, can help the audience kind of see the full picture and understand why people are not getting the help that they need. In addition to that, I would say having coverage on communities with limited resources and highlighting how they're able to implement overdose prevention activities in their community. By sharing those examples of local solutions, other communities may be able to see how they can adapt something similar in their community.
Yeah, I love this question, and to piggyback off of that, I would love to see and read like more articles about the reentry story, about a successful reentry story. I think the thing that a lot of successful reentry stories have in common is the warm handoff, where law enforcement is not just there, to charge and release, but rather as a source of help and assistance. And there's that warm handoff between, being released and then knowing exactly what your next steps are. And that's not just in terms of, employment or in terms of, here's where you need to go and meet your parole officer. It's more about, okay, here's my housing, here's the transportation that I need. And so the reentry story is a beautiful one. It is amazing. It is not linear. Though it is not like you get released and then all the things line up. Addiction recovery is not linear. You do have relapses. You do kind of take one step forward, right? Just to go back. But to me, telling that reentry story is so powerful. Not just for other people who that is their like lived experience, but it provides hope to people, and man, do we need some hope, right? And so I think it's just really, it is an awesome story to tell, and it's much like, when you think about reporting during a pandemic, right? The reentry story doesn't end at a certain point in time, just like we can't pinpoint and say the pandemic is over now, right? We're still seeing the effects of it. So to me, that really helps to reduce the stigma. It helps to show people the nuances of addiction recovery, and normalize that kind of nonlinear pathway. I think also in rural areas, there is a preponderance of thinking that abstinence-only pathways is the way, and that can be harmful. That's not everybody's pathway, right? And so when we talk about medications for opioid use disorder and the evidence behind them, and destigmatizing the medications, I think that's really important. And then one more thing. In telling the reentry story, it is not an individual story or the story of an individual. It is the story of a community. It is the story of the individual's community. It is the story of how families and friends go from perhaps being enablers to supporters, right? To like reentry support. So I think really centering a story around the reentry pathway will be very powerful, and provide a lot of hope for a lot of families.
So before we move on to audience questions, I was hoping you guys could share some resources or online tools that might be especially useful to reporters covering this issue.
So my background is in epidemiology, and so when it comes to the data, a good starting point is your local Department of Health. Also, they may have connections with coalitions. A lot of times, certain counties may have opioid task force. In addition to that, your state Department of Health may have data as well. And what I've seen with local and state Department of Health, oftentimes they publish overdose trend reports online. And so you can look at your particular county or county of interest and really understand and see the overdose trends that are occurring in that community. In addition to that, law enforcement engaging in diversion programs may be good connections. And then the DEA actually has a national drug threats assessment where they have information on drug supply trends. I would say also CDC. CDC has a multitude of data, CDC Wonder, National Vital Statistics System, if you're looking for information on drug overdose deaths.
Yeah, so in Georgia, as I mentioned, the Georgia Department of Public Health are the folks that provide us with opioid-related numbers. I will say that there is a gap in reporting, right, in the sense of they may have some numbers, but we as the public don't get them for a couple of years, so there is a delay there. I will tell you, though, that when it comes to working in rural communities, conversations are so powerful. So I could be sitting at my desk, as an epidemiologist, and I'm like, man, I really wish I could get the last 6 months data. Well, people know what's happening in their community. They see what's going on. And so going to talk to people, and obviously it's not a robust data source, but if you are focusing on a particular county, whether it's for a story or, understanding the latest trends, there are people in the county in the know. And they have a lot of powerful stories. So we do use DPH, we do use qualitative interviews. We do also do strength-based asset mapping in order to understand what are in the counties. But also, another thing is if you're only pulling data from the internet, you are losing a lot in the rural communities. So there are a lot of databases out there that you can plug in the zip code and it'll say, here are the assets available to rural, communities. And being in a rural community, I can go and plug in my zip code and I'll be like, I've never heard of that, never heard of that, never heard of that. Because a lot of those databases are pulling in statewide programs that have never set foot in my county. And so again, that's where going into the county, like legit on, walking in there like in person, right? And asking people, hey, what resources do you know about? What resources are available to you? And hearing their answers is going to be really interesting. And it is something that Google is not picking up, which is kind of fascinating to me that that's still the case, right? But it's just working with rural communities in Georgia has really opened my eyes to data gaps that I otherwise would not have seen.
So, do any of you all have any questions for the panelists?
Hey, thanks everyone for your insight.
One quick thing before you ask your question. Just got to make a quick announcement, or I'll feel bad about this. I suspect many of the people in the room drove. If you're flying out of Atlanta this evening, will you raise your hand? Anybody flying out at 6? What time? Because apparently The shuttle has been canceled because of the vice president's visit.
Wow.
So if there is anyone in the room who's got plans on catching a quick shuttle to the airport, just budget in time to get an Uber or a taxi, because Vance. Thank you.
That applies to me. What I wanted to ask was, earlier today there was a graph presented about the trends of overdose deaths over the last, 10, 15 years. And I think, as everyone is well aware, that there was a considerable rise in overdoses during the onset of the COVID pandemic. And notably, there has been a decline in recent months, years. But I guess I kind of wanted, whereas I feel it was pretty clear that the rise very much coincided with the onset of the pandemic, I didn't quite understand what the decline could be directly attributed to, because it really kind of fell off a cliff. And so I wanted to get your insight in terms of what we might be observing there.
Yeah. Would you like to? Yeah, well, so, I think, as mentioned earlier this morning, it is very, correlation versus causation obviously is very difficult. I think also just like what we saw in the pandemic, a complex web of events. Obviously as epidemiologists, we love to study things in isolation and control for all other variables so that we can pinpoint X is related to Y. I would say that there were a lot of great things that happened. I was going to say during the pandemic, but you get what I'm saying in terms of policies, right? So telehealth policies. We're going out, increase in MOUDs. We're going out, you saw an increase of MOUDs use in outpatient settings. There were a lot of mobilization efforts that happened in response to the pandemic because they saw these numbers skyrocketing. And then, I think this is kind of unfortunate, but sometimes people label overdose deaths as deaths of despair, like when there's economic struggles, right? People are out of jobs, then sometimes you see those deaths of despair increasing. But I want to be very clear that the complex web or chain of events that goes into whether or not somebody uses opioids cannot be reduced to one factor. And I think there was just so many different openings of healthcare services, but then also the social isolation and then the reopening that helped drive that. I will also say that there was, because we saw a change in the types of drugs that were being used, there was starting to be a close down of those pill mills, right? That, of course, had an impact because there was more awareness associated with prescription opioids and the dangers of that. And then there were other practices that were really great. So naloxone started to come onto the scene. In different states, you had naloxone becoming more readily available. And so I just think it can't be reduced down to one thing. But if there are other factors, definitely mention.
No, I agree. Like she said, in epidemiology, trying to explain causation and correlation is something, it's complicated. And so when thinking about the ORS and our teams and what they do, I think a lot of efforts, a lot of overdose prevention efforts have been made, which may have caused just more mobility at the local level, more collaboration between public health and public safety, more efforts in terms of naloxone distribution, post-overdose outreach. And so a combination of all those things has made more awareness when it comes to the drug overdose epidemic. Some things I've seen, for example, in Alaska, like one of our ORS teams actually noticed that public safety officers who are really at the first line of response when it comes to responding to a drug overdose, they said that they just need a little bit more training when it comes to administering the naloxone. And so the ORS team was able to go out there, train the public safety officers who live in remote areas, and also give them naloxone kits. And they reported just feeling more confident in responding to overdoses. I've seen a lot of innovation. I've seen ORS teams work with their public health and public safety partners to implement QR codes at community events. The QR codes link to educational materials that might be on how to administer naloxone. They might be on novel substances that the community should be aware of. And so I think there's just been a lot of innovation.
And if any of the other researchers want to weigh in too, happy to, because I don't want to miss, a primary driver of those numbers that should be mentioned.
Yeah, this is a question from one of our virtual viewers, a trend question. How has opioid addiction affected Medicaid demographic trends over the last 15 years?
Repeat. So how has opioid addiction impacted demographic trends?
Medicaid demographic trends over the last 15 years.
So for me, I'm not able to answer that, but I'm definitely happy to take that question back to my communications team and connect with that person.
Okay.
Yeah, and I will just say that just from my work in the communities, sometimes, especially when opioids came onto the scene and the crisis was evolving, there were certain demographics, white males, middle age, right, that seem to be primarily impacted. But again, what I am seeing when I'm working in the county is it is widespread across multiple demographic groups. Of course, there's always going to be a demographic group that, stands out, but it definitely varies based on location. So I think another thing that was mentioned earlier this morning was the impact on opioid addiction among females in rural areas versus males in metropolitan areas. So I think also focusing on demographics is really important when looking at health disparities and implementing health equity approaches. But much like with COVID-19, there has not been a soul that's, been, skipped over here. It's so widespread and impacts so many people. But of course, health disparities do exist. And when you look at the continuum of care across opioid addiction, whether or not people have access to help, whether or not they utilize the help, whether or not they're successful in gaining treatment or successful in long-term recovery, that is another place where you definitely want to look at demographics in order to see if there's areas that you can focus on. Yeah.
Do we have any other questions?
Yeah.
Can you talk at all about settlement money and whether or not it's making any dent in the crisis?
Oh, thank you for that question. So do you want to?
Oh, sure. Yeah. So the CDC Foundation and the ORS actually was just awarded the Georgia Opioid Crisis Abatement Trust. It's from settlement dollars. Mm-hmm. And so rural communities will be able to apply for funding and implement interventions in their communities that they think would be beneficial. Mm-hmm. Funding is for 2 years. We're still, receiving all the details, so more to come soon. But we're very excited about this new funding.
Yeah, same. So we received opioid settlement dollars in order to work with rural communities. So otherwise, we would not be able to do this work. I will tell you that different states decide how to use their settlement dollars differently. And so certainly looking at a nationwide lens, you will see a lot of variety. But here in Georgia, a portion of the settlement dollars did go directly to helping some of the most impacted communities. And that goes for rural areas and urban areas. Here in Georgia, Atlanta and Savannah, Chatham County are highly impacted by opioid use disorder as well.
I also was going to talk about settlements, but now I'm going to shift. So I understand that there are pockets of data vacuums when it comes to law enforcement and opioids. But anecdotally, given the fact that data doesn't always accurately reflect what goes on in rural communities, anecdotally, do y'all have any interesting stories about the ways in which local law enforcement agencies are helping to be part of the solution rather than the problem?
Yes.
At the ORS, we're all about collaboration, especially between public health and public safety. And so I've seen encouraging collaboration. I've seen partners from different backgrounds come together and really work towards a shared goal in ending fatal and non-fatal overdoses. And so I think just kind of what Jessica spoke to, having that conversation, getting people from different backgrounds in the same room so they can all work towards the same mission. And at the ORS, I've seen that. I've seen that with multiple communities, multiple states, multiple jurisdictions, and it's been very encouraging.
Mm-hmm. And one thing that's on my radar, and I have not seen the numbers, but I'm going to do some more digging, is the impact of having a behavioral health unit embedded with law enforcement. So law enforcement, when they get calls, they're not going in to arrest, they're going in to refer. And so I'm really wanting to dig into that, and I'm going to be soon in the next couple of weeks to see, how is that playing out in the ground. Obviously, in resource-limited areas like rural communities, they have workforce shortages just to keep, deputies employed, right? So starting a whole new unit and having funding for that is going to be a challenge, but I'm looking into that. But let me say this. We're stating that rural communities are not the same, that each one is different. What is it that makes it different? And I think there's a lot of factors. There's not one thing. But when we think about what communities will sign up for your program, what communities will sign up to work with the ROAR project, I really think county leadership plays such an important role in that. And I know it was something I was discussing earlier. Whether or not a county leader, however that may be defined, it could be a county manager, it could be a county commissioner, every state is built differently. Whether or not they see the vision and sign up to be a partner for that vision is going to vary. And I think it plays such an important role on the successful implementation of that vision.
Thank you guys so much. If you guys wouldn't mind, just sharing your contact info with everyone here in case they want to reach out with some questions, use as a source for something.
Yeah. You want me to just say it out loud now? Yeah. Okay. So I'm Schwind, JSCHWIND at georgiasouthern.edu. And you can find us at the Institute for Health Logistics and Analytics at Georgia Southern.
And I am I. Walker at cdcfoundation.org. And please check out our website, orsprogram.org, for more information about the ORS.